My name's Zachariah Bess, and I'm an intern I was an intern at the Arizona Department of Health. I worked for the Chemical Emergency, so they call it the Chemical Terrorism Program at first, and they thought that was a little too crazy. So they changed it to the Chemical Emergency Response uh, Group. But my project for my internship was to quantify, or I guess the quantification of lead in charter school water samples. So what that means is we tested the amount of lead in the water of just various charter schools. Let's go to the next slide. If I can, okay, please. There we go. All right. So just a little background. Impacts to youth health by consuming lead. A few ways that lead impacts the youth, and youth as in kids, is by damaging to the brain and the nervous system. It slows or stunts their growth and development, learning and behavior problems, and that just means that they have like trouble, learning different things. And it was seen way back when they began to like use lead, and then they saw like 20 years later, after lead was used for pipes, that the kids who were drinking the water from the pipes, or the kids who were eating paint chips that had lead dye in it, they were having a lot of like health effects. So they've been monitoring it. Now it's a program that's ran in the state that, so the Chemical Emergency Response Program, that's part of the prevention wing in the Arizona Department of Health. And so what they do is to get samples, test them, and just make sure that things are being prevented. Oh, and the last one was hearing and speech problems. These are all effects that can happen when youths are consuming lead in any type of way. So places lead has been seen to be used are in pipings, in infrastructures, paints, and food colorings. And food colorings can range from dye that's used for seasons like turmeric, and it's very popular in paint and piping. And the reason why I keep saying something about piping is because lead is a metal, and it's pretty abundant metal. So people thought to just use it every single time back in the day, and it's been seen to have a lot of health problems. So my project and my project goals were to quantify the amount of lead seen in the water of various charter schools around the state of Arizona, help the ADHS chemists prepare and run the water samples, and to also build an Excel spreadsheet to be used in the reports being sent out to the various schools. So my experimental procedure was basically, it was straightforward. You acidify water samples with concentrated nitric acid. Then you test the pH of the samples. And then once the pH of the samples was below 2, you test the turbidity of each sample. And turbidity is just the amount of suspended metals or suspended sediment that is inside of the samples. Although like a water sample can be clear, it has like, small particles that are in the water that's just suspended that you can't see with the naked eye, which once is brought through the nebulizer. And this just shows the ICP-MS, like what is it called? Like rough sketch. But the nebulizer is what the samples are going through, and it's a small like tube. It can get clogged up if there's a lot of suspended metals or liquid. Not liquid, sediments. So once you check the turbidity and it's past and it passes the turbidity test, which is usually about if it's below 1 nanogram per liter, you then prepare for analysis. Once you prepare for analysis, you run on the ICP-MS instrument, which is seen to the right of this slide. And just a quick run through. The sample goes into the instrument. You have to use instrument, and because chemists don't like when you use the word machine, but you have the samples that go through the pump, that then once it's pumped up, it goes into the nebulizer, which is brought to the spray chamber. Once it's brought to the spray chamber, is then placed in the coil, and then the torch, which is making the plasma, is blasting it with a lot of plasma, and it allows for the ions to break apart. Once they break apart, then you have these 4 rods, which are called quadrupoles. Those attract to the different ions based off if they're cationic, which is a positive charge, or anionic, which is a negative charge. And based off that, the detector will pick those samples up, and then you'll have these signals that show you the amount of mass, well, not amount of mass, but the amount of the metal or whatever analyte you're looking for, which we're specifically looking for lead 208 to be exact, because that's the most stable one. So our results that I got was ICP-MS was able to quantify the amount of lead 208 using the calibration curve made from the built-in internal standards. The built-in internal standards, which I had in my report, were just standards that we've got from a vendor. And those standards had multiple different metal analytes, and the one that had the most in it in the standards was lead. And we've seen that most samples had non-detectable amounts of lead, which is very good. We don't want lead in children's water, but some samples did have lead, ranging from high to lower counts of lead. And when I say high to lower counts, I just mean that there were some that could possibly have effects, and some that just had lead in it that probably wouldn't have effects, but means that there's probably a trace lead source, or there's a pipe that has that's made out of lead, but isn't directly like attached to the water source for the drinking water. So a conclusion of this project was that the method that we had was reliable, and we were able to have high volume analysis of these samples, because every school sent one sample, like 150 milliliter bottle of water from every single sink that had drinking water, that children use for drinking water or to wash their hands. Then the schools that provided samples where lead was found, they were contacted and informed of the issue they had. And I want to say that this work is very, very important. It's very important in the prevention of childhood lead poisoning. And it was a very big, I don't want to say pandemic, but it was a big epidemic before I was even born. But I think it's still something that needs to be paid attention to, because there are other countries that do not pay attention to lead or don't regulate lead, and there's a lot of health effects that you see. So here are a few of my citations that I got from my report, and also from where I have my data from, in those pictures that I show. And I do want to say a special thank you to WRPHTC, or Western Region Public Health Training Center. You all, one, gave me a stipend that allowed me to just focus on my research and focus on my project, and not stress about funding of paying for my gas and getting to work and doing all these things for my internship. And I really do want to say thank you, and that's why I try to make my report and this presentation at least entertaining and good, at minimum good. So I hope you all enjoyed this presentation. I'm doing it on Zoom just because I guess that's the only thing I have, but I do want to say thank you.